Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. My name is Nitza Alvarez. I'm a board-certified cardiologist with a private practice that specializes on prevention, early detection, and treatment of heart disease in women. My work has been focused in helping women understand that our hearts are different when we have been moving in a system that neglects us. When it comes to heart matters, women are under-recognized, under-diagnosed, and under-treated. The scientific community is actively trying to make strides to close this gap, but we are still many years behind. I'm here to help simplify the science that we know many women can utilize this information to advocate for themselves. I am here to give you tools to become your own advocate and take charge of your own health. Today, we are going to be talking about heart failure. First, I'm going to start with what the definition of heart failure is. When we hear the word heart failure, it sounds the heart is failing. The heart is failing to do its job, which is pump blood. So that is precisely what heart failure is. But how do you know if you do have or you don't have heart failure? When the heart fails to pump, it will present in different ways. Mostly it's going to be shortness of breath. It will be the most common symptoms that your heart is failing to pump. However, there are many other reasons why you might be experiencing shortness of breath. Many of them will be related to your heart. Some of them might not be related to the heart, but understanding that shortness of breath can be a symptom of heart failure will help you navigate a system when you are complaining of shortness of breath and nobody understands what your shortness of breath is or where it's coming from. Now, it's important to know that heart failure presents in a different way in women, and we tend to suffer from a very specific type of heart failure compared to men. Even though heart failure is a condition that can affect men and women, in men, the most common type of heart failure is the heart failure where the heart is weak, and that is very obvious to diagnose. If a man presents with shortness of breath, more likely he's going to get an ultrasound of the heart that we like to call an echocardiogram. So an echocardiogram is a test where we look at your heart just exactly as we will look into your belly if you're pregnant, or like it would look into your gallbladder, like if you go with the pain in your abdomen. So it doesn't require radiation. We put gel, and then with an ultrasound machine that just sends sound waves, we're going to be able to see your heart structure. Normally, when your doctor ordered that test, is because they are interested in looking at how good is the heart pumping. So when that test is done in a man, if they're suffering from heart failure, more commonly the heart is going to look weak. And that is what we call in cardiology heart failure reduced ejection fraction, or systolic heart failure. Systolic heart failure is because the systole is when the heart squeezes and pump the blood out. So we can see that the heart is not doing it very strong. In women, on the other hand, the most common type of heart failure is diastolic heart failure. Much harder to diagnose if your doctor is not thinking about it. Why? Because your heart in the echocardiogram is going to look normal. So if somebody said you don't have heart failure because your echocardiogram looks normal, that is not true. So don't take that for an answer. There is a measurement that has to be done in your echocardiogram to see if your heart is, although it looks normal, is failing to pump. And you probably would say, but why is it failing to pump? Is the heart muscle looks strong? And it's because it fails to relax. Now, if your heart is a pump, in order for a pump to work effectively, it has to be able to push hard, that's what we call systole, and relax quick, that's what we call diastole. In women, particularly postmenopausal women, that relaxation is impaired. So the heart doesn't relax fast enough. When the blood is coming from your lungs, it finds a stiff chamber. So now the blood is like putting blood inside a stiff cup. And whatever cannot fit in there is going to return back and cause back low pressure that is going to end up going back to the lungs, causing congestion, which makes you short of breath. Normally, that is more common in women, and the way to diagnose it is, other than knowing if you had diastolic dysfunction, there is a marker in your blood that your doctor can check. It's called a proBNP. ProBNP is a substance that we can see in the blood that help us identify if there is congestion, if your proBNP is elevated. Normally, any proBNP greater than 150 is suggestive that a woman is suffering from heart failure. However, if you are obese, your numbers might appear normal, but you still can have heart failure. Or you are postmenopausal, your numbers might appear normal, but you can still have congestive heart failure, and your doctor will have to do more testing to understand that. What tests can be done if you're still short of breath and you don't have an answer, and you now are suspecting that you perhaps heart failure can be your diagnosis. Your doctor can take you to the hospital or the lab to look for pressures inside your lungs. We call that a right heart cath. The right heart cath is an invasive test where we put catheter inside your heart and your lungs to measure pressures. If you have heart failure, we're going to see that your pressures inside your lungs are very elevated. We can measure and get an idea of congestion inside your lungs. And also we're going to be able to have an understanding if there is any failing of the pump. So shortness of breath and heart failure go hand in hand, but heart failure is not a synonym of shortness of breath. The same thing that shortness of breath is not a synonym of heart failure. Now, what can happen if you go to a doctor and more often than not, the patients are going to hear this? It's probably because you're overweight. You're short of breath probably because your lungs or because you're older or because you don't exercise. And even though all of those are possible explanations to your shortness of breath, it is very important for a woman to know if they have normal diastolic function or if they're suffering from heart failure, because the potential outcomes of that can be pretty bad. So first, this is how you diagnose heart failure. Once you have the diagnosis of heart failure, then the treatment is super important. Your doctor is going to be suggesting to use medication to help your heart relax better, to help with water pills to unload your heart and your lungs, to help you breathe better. Now, it is important for you as a woman to know that the majority of women have been undertreated, not only because they're not recognized as having a heart problem, but also even after the diagnosis, they're not necessarily receiving the proper treatment. So for a woman that have heart failure, preserved ejection fraction, or diastolic heart failure, your doctor should be recommending that you use a medication called SGLT2 inhibitors, Jardian or Farxiga. Your doctor should be also talking to you about using diuretics if you're symptomatic, and also discussing a drug called a mineralocorticoid receptor antagonist, or MRAs. In that spectrum of drugs, we have the spironolactone, eplerenone, and phenytoin if you have renal problems. That is the minimum that you should be on if you do have diastolic heart failure. So if you have been diagnosed with diastolic heart failure, I want you to use this list as a reference to make sure that you're being properly treated. Now, what happened is you started treatment for heart failure and you're still short of breath and you still feel that you're not making progress. Well, there are other problems that might be present, which is rapid heart rate, tachycardia, or arrhythmias. If you get short of breath mostly when you're walking, then it will be important for your doctor to help use therapy to perhaps slow down your heart a little bit so they can help with that process. And if I explain to you that the matter of the fact is that the heart doesn't relax well, imagine if now you're making a heartbeat 100 beats per minute. It's going to have less time to relax. But if you use medication to slow down the heart some, then that's also going to facilitate that relaxation in between heartbeats. Now, what are some things that you can actually ask your doctor if you are short of breath and you don't know what it is? So we can ask for an echocardiogram. Whenever they're giving you the results, make sure you're asking for your diastolic function. Ask them, what is my diastolic function? Is my heart relaxing properly? Heart failure is not a benign condition. So if you think that your shortness of breath can be coming from your heart failing to relax properly, I invite you and encourage you to seek an answer to your shortness of breath. The mortality rate, the chances of a woman dying from heart failure increases if they're not properly treated. The quality of life of a woman with heart failure is pretty bad, and you don't have to live with shortness of breath if you receive the proper treatment. And the risk for hospitalization increases once you start experiencing shortness of breath if that doesn't get treated. It's important to know that a woman in the postmenopausal stages are at much higher risk of developing diastolic heart failure. And why is that? That has to do with the lack of estrogen in our body. Estrogen is the hormone that protects us from heart disease from when we're much younger. Once we go through menopause, estrogen goes down, and the heart is the organ that gets mostly affected from menopause. So that causes stiffness of the heart muscle, just the fact that we are losing the estrogen. So if you are a woman that is going through menopause or perimenopause and experiencing shortness of breath, just have this diagnosis in mind. Diastolic heart failure is more common than what we think it is. It's just not recognized. If you have any more questions about this topic, diastolic heart failure, feel free to put a question on the comments, or you have any comments about this, or you'd like to hear a little more, or any different topic that is of your interest. I invite you to type it in under comments, and we'll be happy to bring it up in here. And until next episode, I hope that this was valuable to you. Share with your friends and our walk. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD, NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.